Hi, this is David Comfort from Democracy Action Network. Imagine a nation where healthcare is a privilege rather than a right, where the expiration of subsidies could send millions spiraling back into the abyss of unaffordable medical care. This isn't a dystopian future. It's the reality looming over us as the Affordable Care Act, ACA, health insurance subsidies face expiration. The contradiction lies in the fact that we often celebrate progress in healthcare access, yet we remain one legislative decision away from undoing it all. Historically, the ACA was a landmark achievement designed to bridge the chasm between the insured and the uninsured. It provided vital subsidies that allowed millions to access healthcare services that were previously out of reach. Now, with these subsidies set to expire, we must confront a stark truth. The very system that was meant to protect us is on the verge of unraveling. A vivid example can be drawn from the aftermath of the Great Recession, when millions lost their jobs, and with them, their health insurance. The result was a public health crisis that underscored how intertwined our economic stability is with our access to healthcare. The expiration of these subsidies will disproportionately affect low-income families and individuals who rely on these credits to afford their premiums. The numbers are staggering. Without these financial lifelines, many could see their insurance costs skyrocket, forcing them to make impossible choices between healthcare and basic necessities. This isn't just an economic issue, it's a matter of human dignity. The stories of those impacted are not just statistics, they are real lives, filled with hopes and dreams that could be dashed by a single policy decision. Moreover, this impending crisis highlights a deeper pattern within our political system: the fragility of progress in the face of partisan battles. The ACA has been a target for repeal since its inception, revealing a persistent struggle between those who believe healthcare is a human right and those who view it as a market commodity. This ideological divide is not merely academic. It has tangible consequences for millions of Americans who depend on these subsidies for their health and well-being. As we stand on the precipice of this critical juncture, it's imperative to recognize the stakes involved. The expiration of ACA subsidies is not just a policy change. It represents a fundamental choice about who we are as a society. The clear takeaway is that we must advocate fiercely for the preservation of these subsidies, not only to protect the vulnerable, but to affirm our collective commitment to a more equitable healthcare system. The fight for health justice is not just about policy. It's about the kind of society we choose to build. Please like this video and subscribe to our channel. It would help out a lot. Peace.